Hello guys, welcome back in my new video, and today's topic is diuretics. Diuretics. So what is diuretics? Diuretics are drugs which increase urine volume, high urine. Actually, diuretics are drugs which works in nephron on the transporter. These transporter reabsorb the primary urine. So these drugs works on transporter and inhibit the transporter. So these transporter cannot reabsorb the primary urine in blood. So due to this, urine formation will be high. So this is the diuretics. Mainly we have 5 types of diuretics. The first one is loop diuretic, the second one is thiazide diuretic, osmotic diuretics, and carbonic anhydrate inhibitor. The potassium sparing, and in the potassium sparing there are two mainly types: aldosterone antagonist, inhibitors of sodium channel. So these are 5 types of diuretics. In this video I'm going to talk about mainly 3 diuretics: loop, thiazide, and osmotic. So in the loop diuretics there are 4 drugs: furosemide, bumetanide, torsemide, ethacranic acid. And in the thiazide there are 5 drugs: hydrochlorothiazide, chlorothalidone, metolazone, xipamide, and indapamide. In the osmotic diuretic there are 4 drugs: mannitol, urea, isosorbide, and glycerol. And carbonic anhydrate inhibitor, 4th type, acetazolamide. And potassium sparing diuretic, there are, I already told, 2 aldosterone agonists in the spironolactone and eplerenone. And inhibitors of sodium channel, there are 2, triametrine and amyloid. So this is the 5 types of diuretics. So let's begin and let's discuss about loop diuretics. So as I told you guys, diuretic, these drugs on nephron. So now I'm going to draw nephron, so that nephron I can clear the drugs and transporter. So how drugs works on the transporter, so that we can increase the urine formation. So here we have the nephron. Now I'm going to draw the nephron. So this is a Bowman capsule, and here eventually there is a PCT. This is thick descending loop of inlet, thin descending loop of inlet, and eventually this is thin descending loop of inlet, thin ascending loop of inlet, and thick ascending loop of inlet, and this is DCT, distal convoluted tubule. This is DCT, distal convoluted tubule, and there is a collecting duct. This is the collecting duct, collect urine from the all nephrons. So one arteriole, afferent arteriole comes. This is a thick arteriole and filtered in and make a glomerulus, so that urine can filter, and a thin afferent arteriole, and here efferent arteriole. So here in the Bowman capsule, filtered urine called primary urine. So this primary urine, filtered primary urine, is here. So this is the PCT, proximal convoluted tubule. So in the proximal convoluted tubule, and then we are going to talk about loop diuretics. So here loop diuretics, and there are, I told, 4 drugs: furosemide, bumetanide, and torsemide, and another one. So loop diuretics works mainly in here, ascending loop of Henry. There is one transporter. So this is, I'm going to, and I will take this part to make a big diagram so that I can clear. So like, okay, so this is a transporter. I'm going to draw this transporter. This is a big transporter. I take a big diagram. So there is a, this is a epithelial cell. So in the luminal side, this is the luminal side and this is basolateral side. And this side is a vasa recta, blood, so that primary urine can be reabsorbed to the blood. So this is the basolateral side, basolateral, and here luminal membrane, basolateral membrane, and here this is the transporter. So in the loop diuretics, mainly 3 ions: sodium, 2 chlorine, 1 potassium. So they actually they go through this transporter to inside the cell, and the loop diuretics drugs, they just works in this transporter. So when this transporter will stop, these drugs will stop this drug, so that they cannot go inside. And how they works, okay, now I will discuss. There is one enzyme called sodium potassium Atpase. Sodium potassium Atpase. So this sodium forward go to there, and here is a sodium, and there is also one channel, potassium channel. So what is the function of this potassium? Actually 1 plus, sodium is a plus, 1 plus go outside of the cell, and this potassium will come inside the cell. So 1 plus is going out and 1 plus is coming in. So here this potassium came, and the work of this potassium is to just circulate. Potassium will go out, one sodium will go inside of the blood this vessel, and there is one chlorine. So 2 chlorine are there. Here is a chlorine channel. So this chlorine will go. Here is a 2 chlorine, and here is one more. So there is a potassium. So 1 sodium, 2 chlorine is here, and 1 potassium. So potassium, this potassium is also function like ring. This potassium came out, and here is the potassium. So this potassium is ring, and this potassium, and so now the answer is, here is 1 sodium and 2 chlorine. This is how the transporter works. The luminal is now explained, luminal side and basolateral membrane. So how loop diuretics works? They just transporter of this transporter. So this is the loop diuretics. Actually, the uses of loop diuretics: acute pulmonary edema, hyperkalemia, hyperchloremia, and hypernatremia. This is the uses of loop diuretic, and what can be side effect. If I will talk about side effect, then autotoxicity. Autotoxicity is the problem with the hearing. You will have the problem with the hearing. This is the side effect. And potassium depletion, hypomagnesemia, acute hypovolemia, and hyperuricemia. These are the side effects. Again, I will talk side effect: problem with the hearing, hypermagnesemia, and acute hypovolemia, hyperuricemia. These are the side effect and uses. Now I will go. 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 next one. I'll go to the next one. The next one is thiazide diuretics. This is the thiazide diuretics. In this diuretics, thiazide diuretics works in DCT here. So how this work? Okay, again I will take this transporter and I will keep here. And this is the luminal membrane, luminal and basolateral membrane, and this is the transporter. There are two ions, sodium and chlorine. They just symport of the sodium and chlorine. Symport is sodium and chlorine. I already told you there is a sodium potassium Atpase enzyme. So this enzyme will work and take sodium out, and here is the potassium. The potassium will circulate like this, and sodium can go the outside of the basolateral membrane, and there is a chlorine channel. Now chlorine is out. So this is how the transporter works in the DCT, distal convoluted tubule. So thiazide diuretics, these diuretics works mainly in this transporter and stop this sodium chlorine symport. So this is the thiazide diuretics. So what is the uses and the uses of thiazide diuretics is hypertension. Mainly in hypertension we can use we can use this and heart failure and hypercalciuria. We have one hormone from the parathyroid gland, that hormone called parathormone. That parathormone increase the calcium level. Parathormone also works in the DCT. We read in endocrinology. And this thiazide diuretics also used in diabetes insipidus. So these are the uses. Uses are for hypertension, heart failure, hypercalciuria and diabetes insipidus. Now we will talk about side effect of diuretics. There are hyponatremia. Hyponatremia can be hyponatremia. How if we will stop this transporter, so sodium cannot go into the blood. If we will give high level of high level of these drugs, then hyponatremia and hypochloremia can be also the side effect, and hyperglycemia is also the side effect of this thiazide diuretics. So now we are done with the thiazide diuretics. Now I am going to talk about osmotic diuretics, the third one and the last one. The third one is osmotic diuretics. So place action. Actually, the osmotic diuretics mainly works in PCT, proximal convoluted tubule. Guys, one more important topic: the primary urine comes to Bowman capsule per day 180 liter per day. 180 liter per day filters in Bowman capsule primary urine and reabsorb 70% of reabsorption happens in PCT, 25% of absorption doing by this ascending loop of Henle, and 5% from the DCT, from 5%, and also from the collecting duct. In the collecting duct, work potassium sparing diuretics work function. This diuretic I will talk in next video. So this is potassium sparing diuretic work in collecting duct. So now we are in osmotic diuretics. So okay, I will take this cell and I will. This is the epithelial cell, luminal side and basolateral side. So of course here is a one concentration, and the blood is also, the concentration is also matters with the reabsorption of urine. So if we can increase the concentration of PCT, primary urine concentration, if we will increase, then so what is the osmotic formula? If concentration, this is the luminal side, if we will increase the concentration of luminal side, so blood in the blood side concentration is decreased concentration and increased concentration with the help of drugs like mannitol, urea, glycerol, isosorbide. These drugs do not works with the metabolism, they just increase the concentration. So urea is not there is no work in metabolism. Urea not mainly. So if we will give intravenously, not with orally or intravenously, so this urea will increase the concentration. So osmotic formula is say, if there is more concentration, so water cannot be reabsorbed. Water does not go to inside of the blood. So this is the formula of osmosis. Water does not allow to go inside of the blood. So here stop is reabsorption is stops. So this is the osmotic diuretics. We are done with the three diuretics: loop diuretics, thiazide diuretics, and osmotic diuretics. The uses of osmotic diuretics. Actually, there is a uses of diuretics is we use in cerebral edema. If any trauma also, and the poisoning, if someone have poisoning, so concentration is increased, so poison will just flushed out with the urine. And acute renal failure, if any acute renal failure also the uses. And the side effect, what can be the side effect? Side effect can be dehydration and hypo or hypernatremia and extracellular water expansion. So these are the osmotic diuretics, and these are three diuretics. Thank you so much guys. Please like, subscribe and comment my channel. Thank you so much guys. Thank you.